Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Lisbeth Roy, founder and medical director of the Doctor's Studio of South Florida, and an expert in anti-aging, sexual, and regenerative medicine. Dr. Roy practices a non-invasive approach to total body wellness and has authored Regenerating Sexual Potential. So let's start at the beginning, Dr. Roy. What motivated you to attend medical school and become a physician?
Oh, wow, that really is the beginning, isn't it? Well, I started my career actually quite late in life. I had my son when I was 19 years old and actually went to college at age 27, and I thought I wanted to be a veterinarian. And as I started my anatomy and physiology course, I thought, wow, this human body is actually quite interesting. So that's where it began. And I was working with the Dartmouth Medical School doing some clinical trials while I was in college, so I was exposed to the medical community and became very, very interested in caring for people. And unfortunately, I realized the limitations of the traditional medical model. Or fortunately, I guess you could say, I realized the limitations of the traditional medical model, and I was looking for more. And at that time, there was no A4M or functional medicine, as it were. So I thought I could get through medical school, and then I would have to find my own way. Once I finished medical school, which was quite a long journey, as you can imagine, at age 27 as a freshman in biology, I was fortunate enough to be searching for some sort of structured, integrative type of a program, and I found the A4M fellowship. And that's when I really started diving in. So I've actually never practiced traditional medicine. I went through medical school. I started a family medicine residency program, and actually went immediately into the A4M fellowship and started my functional integrative training right alongside of the traditional family practice.
Was there a catalyst that made you motivated to go that route?
Yes. So my son, who was 12 at the time that I started medical school, became ill. And I really could see then what was problematic with general traditional medicine, and really wanted to embrace whole wellness and an approach that really lended itself to a solution rather than just a Band-Aid. So as a patient, or rather as the mother of a patient, I saw that there was a tremendous need for a different type of delivery of care. And so my son's illness is really the beginning of that adventure. I was interested in medicine, certainly just as a curiosity, and as we were advancing through the anatomy and physiology, it became fascinating to me. I have a very mechanical mind, and so to look at how the body really works was my primary focus. And realizing that that's not how traditional medicine is delivered was a bit devastating to me, especially in the face of this personal challenge with my son's health.
Were you able to find physicians that worked with you in an integrative approach?
Yes and no. To some degree, yes, we had some success finding some doctors who were willing to go there. Unfortunately, there wasn't a whole lot of care for him. And in fact, I lost him 6 years ago.
Oh,
yeah, thank
I'm
you.
so sorry.
Thank you. So it was quite a journey, actually, this being in medical school, being in the trenches of medical training and functional medicine training as my son was just getting sicker and sicker was really very challenging. So I did find some caring physicians who tried to help us and opened my eyes to some possibility. Yeah, and like anything, I think you learn often what not to do is very, very valuable as well. And so I had some experiences with some, pretty high-level respected physicians that I would not emulate. And I think that was valuable as well. Just having that whole patient experience, I think, has made me who I am, for sure, as a physician.
So you've been practicing medicine for how many years?
11.
Okay.
Yeah.
And how have you integrated this functional integrative medicine into your practice?
I was in my family medicine training. I actually left my program as a result of my son's illness. Just felt like, our time was limited.
Right.
And I wanted to be with him as much as possible. I was in the middle of the fellowship at that particular time, and I opened a practice called the Anti-Aging and Aesthetic Institute, and I knew nothing about either one. And so that's kind of how I do things.
This seems to be a common thing sometimes post the fellowship. So
yeah, I think that's the important thing, actually, and,
right.
and I want to talk more about that and how to implement this into your practice, because that's valuable. And just jumping in and realizing that we're perpetual students, and so having that humility and understanding that you've got to be comfortable being uncomfortable, that was the way I got started. So I started this practice. The aesthetics really funded my anti-aging and functional medicine education, so it was quite successful in that regard. I started with the hormone module, and Monday morning when I came back from that weekend, I just started implementing. I thought progesterone would cure everything. And of course it didn't. It helped a lot of people, but it was getting started that was important.
So you were considered a sexual wellness expert in your field?
Well,
so what does it take to become a sexual wellness specialist? My husband would like to know that answer to the question.
Yeah. Well, that's been, quite a journey. I'm not so sure I'm an expert, if you will, but I've certainly had quite a bit of experience. As I went through the fellowship and started implementing hormones and nutrition and GI wellness, all of these things, I realized that there is so much to the human experience, and certainly sexual wellness and confidence and intimacy and self-confidence is really so important. There's a lot that we can do when you clean up the body and you apply the right nutrition and the right hormonal balance. For sure, things change. But there's a whole bunch of people who don't fully recover and resolve these sexual issues. I started using platelet-rich plasma about 6 years ago and found some tremendous benefit, actually, to regenerating that tissue. And I think that's the important piece about being a functional physician and doing some of these procedures. I've trained hundreds of physicians to do these now, and I find that not only do many of them have a challenge in implementing, which we really need to definitely get into because that's a key, but also you have to have more than just a hammer in your toolbox. So to come from a traditional medicine background and try to jump into offering some of these procedures, you're definitely going to have some success, but it's going to be rather limited. As a functional physician, I can look at the whole person and really hear the story, the physiologic breakdown, what might be necessary in terms of hormones or nutrition. I've realized that tremendous benefit as I've trained these other physicians to do the techniques. The techniques are not difficult by any means. It's really understanding, however, that's just a tool in the toolbox. It's a valuable tool, but it's just a tool in the toolbox. And applying the other tools are incredibly important, whether it's sexual wellness or you're trying to regrow hair, or even for aesthetics, and general wellness overall.
So as you didn't practice traditional medicine before, you can't make the comparison between the quality or quantity of time that you spend with the patient today.
No.
So just tell us, if you will, what your typical initial visit is with the patient, the amount of time you spend, and how much do you delve into their history?
Okay. I experienced some of that quantity, certainly, in my postgraduate training, of course, and realized that wasn't where I wanted to go. So fortunately, I've never taken insurance. I don't know anything about that. I only know that I invite patients to come in and tell me their story. And so we delve into what's happening with them, and not just medical history, but just symptomatology and experience in general. I find a lot of patients that I take care of don't have a very impressive medical history, but they don't feel well. So they haven't been diagnosed with anything, but they certainly have had years and years of imbalance and less than optimal wellness. So we spend a lot of time talking about how they feel now. I don't spend a lot of time talking about what they eat now, because what I find is I don't care. I want to tell them what they're going to, or what they ate before they came in. I don't care about that. I want to tell them what to eat now, how to live now. So what I've realized in trying to balance functional medicine, good patient care, as well as a business model, that's very important to try to pull all that together, that I don't spend a whole lot of time talking about what they're doing now, because it's not what's going to be helpful. We spend most of our time talking about what we're going to do moving forward and how to really change how they feel. And so much of it is what they eat and the thoughts they think, and just basic things. I clean all of my patients up. They'll go through an elimination detox type of a program, 6 weeks, and then we'll meet again. And at that particular point, it's like icing the cake with a lot of the functional medicine tools and hormones and nutritional supplements and medical foods and so on and so forth. And it's really my role as a coach. So I have the knowledge, certainly, but the key and the magic really is in coaching them to that place where they feel better than they ever have. And then they recruit their families in to enjoy this same wellness. They'll, even if their families don't see me, that's perfectly fine. They're really carrying the torch forward because I've taught them what they need to know. Absolutely. Yeah.
So it must be quite validating and rewarding for you. Can you share a story of a patient?
Wow. There's so many stories of patients. Yeah, let me share one that I took care of recently. A woman who had sexual dysfunction, severe urinary incontinence after having breast cancer 13 years ago. She takes very, very good care of herself, so her diet was right. She was afraid of hormone therapy, though it's not necessary for her to be afraid of hormone therapy. She was afraid, and her doctors had told her that was not something that she could do. She saw a news piece on one of the procedures that I do, the O shot with platelet-rich plasma, and she thought, aha, this is the magic wand. So she came in, and it was part of what was magic for her. We went ahead and did this procedure, and within 4 weeks, she truly feels like she has her life back. It's a beautiful story, actually. She had severe urinary incontinence such that she had to stop at least a dozen times to use the restroom on the way to my office. It was about a 2-hour drive. It interferes significantly with a woman's life, and 50% of women actually have a problem with this. So it's a big, big deal. That's not even why she came to see me. She came to see me because she could not have sex with her husband, who she loved. They continued a beautiful relationship, but she felt that missing piece, that intimacy that's really so important.
How old of a patient?
52 years old.
So young.
Yes.
That way, right.
And, 13 years post-breast cancer, really doing well, very grateful for the treatment that she received, but this was a missing piece. As a result of just that procedure, she reported after 4 weeks having pain-free sex.
Oh.
Yep, I know, which is amazing, right? So pain-free, really life-changing for her to re-engage with her husband that way. And when she came back for a follow-up appointment, she did not stop to use any bathrooms other than her own and mine the entire trip, which was a huge, huge deal. That's when she told me she actually had that problem, because she didn't even report that to me. It was secondary to her, to this sexual dysfunction problem.
It became a way of life for her.
It became a way of life. Her family hated to go anywhere with her because this was just the way that it was going to be. But what's really cool about what we do every day and how we change people's lives is she told me that her husband confessed to her that he thought that the breakdown in their intimacy was him, and he didn't dare to talk to her about it. He just didn't want to rock that boat at all. And so for him, this was really getting his life back as well, because he'd missed that intimacy with his wife. So she's one of my biggest fans. That's recent story. And there's just, hundreds of patients that will come in with low energy, bowel issues, rashes, problems with sleeping, all in the same person. I mean, this happens quite frequently. Nothing is diagnosed other than, maybe they have eczema or psoriasis. The underlying issues are not identified. And so we go to work, again, elimination diet, clean up the gut, look at hormones, and can quite frequently resolve all of those questions. I've had patients who have had irritable bowel syndrome for 40 years, and it was the bane of their existence. Their belly always hurt. You're not supposed to be aware of your belly. You're just not. And so many people are. All day long, they're uncomfortable. They don't sleep well. They may have some reflux. It's embarrassing.
Can I make an appointment?
Yes. Their clothes don't fit the way that they should. And, quite frequently, in 6 weeks, things change significantly because you identify what the issues are. And quite often, these are not complex issues. These are just understanding how the body works, which is what's wonderful about
function. You're getting to the root of the problem. Yeah. You're not treating the symptoms.
Absolutely. I've had patients who finally their primary care physician will test them for celiac disease, and they're negative. They don't have celiac disease. So their doctor says, hey, eat all the wheat you want. It's perfectly fine. Well, all the while they're suffering, and their doctor can't figure out why. So they call it irritable bowel syndrome, which is just a collection of symptoms that nobody knows what the cause is. And it's really quite frequently food sensitivity and GI imbalance. So as a functional physician, eliminate all the common allergens: wheat, dairy, eggs, tomatoes, potatoes, eggplants, peppers, soy, corn. All of these are things that we just take right out of the diet for about 6 weeks. Add some probiotics, add some good fats, and voila, quite frequently you have some magic. You can do a stool test to really hone it in and make sure there isn't a parasite, which we find quite frequently. Easy to treat once you identify what it is. And people really get their life back because these GI symptoms are central to just a patient's well-being. Their hair they don't thrive. Their skin looks unhealthy. Their hair, they're not bright and vibrant. And again, it interferes with everything. So these problems are not difficult to fix quite frequently.
What do you find is the commonality or the final straw that makes somebody leave their traditional medicine practice? This is a patient. Mm-hmm. For them to finally say, enough is enough, I'm leaving my doctor. They're not treating me as a whole. They are treating my symptoms. And what makes that patient finally leave and go seek a functional medicine physician like yourself?
Yeah, it's happening in just huge waves now. Really, there's been a tipping point where there's not enough functional physicians around to take care of everybody. I don't even market my functional medicine practice because I would be completely overwhelmed. You have a waiting list now, so wow. It's happening. And the reason it's happening is because they don't feel well, right? So if you go to your doctor and you don't feel well and they are able to diagnose the problem and give you a solution, whether it's in a pill or not, there's no judgment about how it's delivered, then you don't need me. But the problem is that's not happening. Patients are seeking care and they're getting suboptimal results. They're tired of having a cholesterol medication and then a blood pressure medication and then realizing that nobody really told them that they were developing insulin resistance, even though all the signs were there. Finally, now they have diabetes or pre-diabetes, which, they're finally getting upset about that and realizing that there's a different way. That, just because your family has cardiovascular disease doesn't mean you have to. I always tell my patients, the family history is important because it helps us identify the weak link. But then you go ahead and strengthen the weak link. You don't necessarily have to manifest that disease. So I think patients are just tired of taking pills and not feeling great. Again, you take a pill, it lowers your number. If you felt well, then they may not be compelled to really look for a different way. But they don't feel well. And we're living longer, and we expect a lot more out of our life than, just even our parents or our grandparents' generation. I'm in my 50s. I feel like I can be better in the next 50 years than I was in the first 50 years. And I think a lot of people are really coming to that realization, so they're seeking some options.
or how do you see that your personal life differs from a traditional medical doctor?
Well, probably the biggest way is that I feel very, very happy to see my patients, and I feel valuable. And my patients get better, and then certainly there is a lot of work involved, not only for me, but especially for the patient. It's very rewarding to be able to move someone to act, and I feel that that's the huge advantage with this particular model. I don't know how my traditional colleagues actually do it all day long. They don't have the time that they need to really engage with their patient. They want to. I truly believe that they want to. It's not a lack of caring. It's a lack of resource. It's a lack of really time. And there's some knowledge as well. There's a lot of knowledge that's necessary to be able to promise somebody they'll feel better. I mean, I sell it. I am selling wellness. The minute they walk through my door, I am selling wellness. And by the time they leave, I have asked them to do so many difficult things, and they can't wait because I understand that they are going to feel much better once they really do engage and make it happen. And that's where the art is. I mean, the art is really in delivering the information in such a way that people will engage, and learning how more information is not necessarily better. You have to spoon feed it and stay with them. I've had patients that, they'll come in every 3 months. Maybe we're doing hormone pellets, and I give them the same information each time about changing their diet, and they tell me, they're not happy with their weight. They feel better. They're not happy with their weight. We're still struggling with some of these things, but they haven't been able to do what I've asked them to do. And so I just stay patient, and I say, I really care about you, but I don't have any different information. If you had tried this and it didn't work, well, then we could go somewhere else, but you haven't tried it yet. And so I'm going to give you the same information. And they say, yes, I know. I'm going to do it this time. And then finally, 3 years later, they'll walk through the door, and I'll say, oh my gosh, what have you done? You look amazing. And they say, I've done everything you've asked me to do, finally, after all these years. And so, it can be frustrating for some people. But I don't look at it that way. I look at it as a real challenge. You either have a challenge trying to figure out the diagnosis, or you have a challenge trying to get the patient to do what it is they need to do. And so compliance is very high in this type of a model because you have the time with them, and so it's rewarding. And because I firmly believe, because they're paying for the service. I joke with my patients, but I'm really not joking. I'm serious, and I'll say, and if you don't do what I want you to do, I'm just going to charge you double. And we laugh, and they say, oh, no, I'm going to do it. I've paid enough to be here. So sometimes you have to move them by hitting them where it hurts. And sometimes that's the wallet. So our traditional colleagues don't have those tools available to them. And so though I work hard and I'm tired at the end of the day, it's really awesome to be able to impact people's lives. And that's not to say that my traditional colleagues don't either, but I know that they're very, very frustrated in their lack of time to dig in. And so you have to separate. I think that's what ends up happening, and that's what people are feeling, that we're human beings and we come to medicine to help people. And if all day long you're battling the clock and the limited resources,
and the bureaucracy.
And the terrible bureaucracy. You have to separate in order to survive and have a life yourself and a family. And I think that's the biggest difference for me anyway.
So I assume you've never taken call?
Never.
And your weekends are yours?
Yeah, though I will tell you, every one of my patients has my cell phone, and nobody ever uses it. But I'm available. So
it is quite a unique and special way to practice medicine.
It really is. It really is. And what you find is when you develop that level of trust, the way I became a sexual medicine expert, right, as you call it, is my patients trust me. And so when I bring something home, they're ready. They're ready. If I believe that it's going to be helpful and I'm very transparent and I let them know that you'll be my first one, or these are potential complications. I'm always on that edge of learning and sometimes pioneering. And so when you're out there by yourself and you're not really sure what's going to happen, and your patients trust you to think through the possibilities, it's a beautiful thing because you can discover together. When I bring something home to implement and I find the right person, it's just so much fun to see what happens. So you feel like there's an exploration together for their benefit. And they always feel that it's for their benefit, which is nice.
What advice would you give to a physician who is contemplating starting a functional medicine practice or first starting their A4M fellowship or considering doing so?
I would say go slow in that start immediately with the intention of implementing what you learned right away and realizing that it's enough. I find that a lot of physicians will attend all the modules and they'll dive right in, but they never take it home and do anything with it because they feel like they don't know enough. Realize that you'll never know enough. Realize that you're always going to be learning, and that if you pick up one or two things from that particular module and you bring it home and you start to work with it and use it, you'll find the ways that it's beneficial, you'll find the limitations, and you'll be ready then to move on to the next thing. So implement, implement, implement. That's really the key. Do it. Start somewhere.
As Nike says, just do it.
Yeah, it's really important. So I find the biggest challenge that doctors have is implementation, especially physicians who are coming from the traditional model. You know, there's a lot to consider. There's a financial model, there's an ethical model, and really the way I bring these things home is I first run them through my ethics, and if they meet the ethics, they go on to the business model, and if they meet the business model, then we're good. We start to implement these things. So it's very important to understand that whatever you're learning, make sure that you feel good about it, that you would treat your family this way, so that's that ethics. Know that it's just another tool. It's not the only tool, so it's not a limited resource. You're going to gather all kinds of tools as you go through here. You'll have all kinds of things to, as you go through the fellowship, you'll have all kinds of things to offer. Get your team excited at home. Bring your team with you. I think that's a big piece of success, is to really translate that excitement to your team. Physicians will come through my training and they won't bring their team with them. They will be so excited by the time that they leave, but now they have to go home on Monday morning. They have to then translate that excitement to their team and get their team involved. And sometimes the team can be the tough sell. So think ahead. Think ahead of what is it that you really hope to accomplish here. Get your team excited. Spend the money, spend the time to go through the program with the focus on implementation. And there's so many resources available through the A4M and through the physicians who have gone through the fellowship. Most of us are very collaborative in nature. That's the other benefit to this side, if you will, of medicine. I have found that we are sort of trained to not collaborate because our egos are developed during the medical training process, unfortunately. You know, ego really is the enemy, and it's the patient enemy as well as the enemy to the physician. And so we're fearful quite frequently about collaborating. I think that we need to do a whole fellowship module on just how to work together as a team and how to collaborate and how to implement and how to share. You know, when 50% of the population, for instance, has sexual dysfunction, men and women, and the same women with urinary incontinence. That's a huge market. No one doctor can take care of all of those patients. And there's reasons why we share information so that we can continue to improve patient care. And so collaboration is such a key. You know, my focus in my trainings and the network that I'm part of is really about patient care. And so if you learn how to do the procedure and you figure out, you tweak it and it's a little bit different, or you come up with a little pearl, a little nugget, share it with the whole team, because the better we can take care of people, patients, the more our businesses thrive. It's really a misnomer to feel like there's competition. There's no competition. 50% of the population has a problem. There's no competition. The competition really is to make it as good and as effective and as safe and as acceptable as possible to really start the conversation. And so though I think it's still lacking in the functional integrative anti-aging world, it's certainly 10 times more collaborative in that regard. We're usually more entrepreneurial and willing to share. And as an entrepreneur, you know that you don't have to protect anything. You network and you learn from each other, and it makes us all better.
And there's such a difference from when you started in this field to today, and the acceptance rate and just how people are embracing this, both physicians and patients. So it must be, quite validating for you as well.
It is, and it's interesting you say that because I always joke that I practice on the down low. Nobody knows who I am, or where I don't know anybody in my medical community. I just sort of put my head down and treat patients, and they find me, and that's how I've done it. And it's been really nice to be able to come out of that mentality, if you will, and to feel like there are a lot of physicians also who are focused as I am on patient care and embracing these ideas and seeing the good outcomes that I'm seeing.
So where do you hope that this field is in 5 years or 10 years?
I think the field is moving at such a rapid pace that it's hard to imagine it being more than it is. I think we could slow things down, perhaps. I find myself wanting to slow things down even in my whole practice to add value to the information that's already there. I don't think we have to learn anything new. I think we have to get better at controlling our environments and infiltrating our communities and helping our communities all come to a place of wellness. I guess that's what I'd really like to see more and more of. And some of the leaders have been doing a great job at that, and writing books that are impactful and developing social networks that are impactful and people coaching people. We are moving so fast, it's hard to know what we're going to be able to do. And I think that living longer is a wonderful goal. But the quality of that life, in my mind, is perhaps even more important. And so the quality of our lives as physicians, as well as patients, I see, I guess to really directly answer that question would be more collaboration and more camaraderie and more of a network of physicians supporting each other. When I go to a traditional medicine conference, so I have to go to them every couple of years to maintain my license. And I say I have to because I hate going. It's a huge, huge room full of hundreds and hundreds of physicians. Most of them are overweight. Most of them are having a hard time paying attention. Most of them are reflective of our society, not healthy. When you arrive and it's 7 o'clock in the morning when the opening statements happen and they're going to serve you breakfast, and I'm not kidding, the last one I went to, it was chocolate chip cookies, and there was soda, and there was tap water. Couldn't find a bottle of water to save your life. There wasn't a piece of fruit. There was no protein, no good fat. I mean, it was horrible. It was really so reflective, I think, of what's happening out there. The care providers don't even know how to care for themselves. And I don't know if I'm the only one in the room of 1,000 people who even understood, but to me it was overwhelming to actually see this reality. And so what I'd like, when you go to a functional conference or you go to an A4M, there's beautiful food. It's a whole experience. Everyone's at the edge of their seat listening to the information and excited about how they're going to apply this. I know I think about patients. I mean, patient names are popping into my mind. Oh, David could use this. Sarah could use that. I'm making notes about who I'm going to do this test on or use this new supplement. And so that's, again, implementing right away. But just, I think, spending more time taking care of each other is where we need to go with this particular specialty, with this particular way of thinking. We're still, as physicians, running, not taking as good a care of ourselves and not taking care of each other. And though we're doing a better job as functional physicians than we were perhaps than as traditional physicians, we're still not doing enough as a community of physicians to care for each other. Emotionally, professionally, it's not easy to be a doctor. You feel like you're a big target quite often, especially if you have any new ideas. But even just that competitive nature, I think, has to change. And although I think it's wonderful to compete, we need to compete for the right things and make each other feel valuable as a physician family, as a medical family. That's how I would like to see it change. I'd like to see a whole module on that, how to be a better colleague. You know, I love what I do.
It's obvious.
It's not without its challenges, but I see so many. I think the teaching has been so great for me because it's allowed me to come out of my box. You know, I have felt half-trained most of my career. Leaving my residency program early to care for my son, I felt, wow, you know, I didn't really, I don't have that board certification. I didn't have those credentials that we think of as so important as, you know, professionals. Well, what are your credentials? Well, my credentials now are pretty impressive because I've taken care of a lot of people. I've taught a lot of doctors. I've learned a lot of things. But it's not that paper type of a credential. And so that's when I practiced on the down low. It really was just that feeling of not enough. You know, and I'm not alone. I mean, I'm brave enough to say it out loud, but I'm not alone. I think so often physicians will feel not enough, and it's a big problem. I think it's a big problem. I learned that in my son's adventure. We would be met with physicians who were truly so fearful of what was happening to him that they alienated us, that they threatened, and were not willing to have a real conversation about, okay, you know, look, this isn't your fault that he's not well. I don't even expect you to be able to cure him. Let's just sit down and talk about how might we live with this? What might we need to, you know, I have to take him home. And he wets the bed every night now as a 17-year-old, and he's losing his function. And so, you know, how do we just put all of this responsibility aside and come together to have a real conversation about how to live a quality life? Yeah, sure, he's not going to be here forever. None of us are. But that's part of medicine, in my mind. It is in my practice. It is absolutely in my practice. You know, if you're dealing with someone at home that is not well or challenged for any reason and it's impacting your life as my patient, we're going to talk about that, and we're going to try to get that person help so that it can help you. You know, it's just a bigger conversation, I think, that is really beneficial when there isn't that ego and there isn't that fear of, I'm not going to be able to solve this patient's problem. I'm not going to be able to give them that magic pill. They're going to come in with the same symptoms again and again and again. You know, doctors really are afraid of that. They hate seeing some patients. Oh my gosh, Mrs. Jones is on my schedule. I don't know what to do with her. So instead of hating Mrs. Jones, if you put the ego aside and you welcome her and you give her a big hug and say, okay, did anything we try, was it any better? And you just keep working at it, knowing that I promise you, Mrs. Jones is not blaming you for not feeling well. But Mrs. Jones has felt abandoned by so many doctors in the past because they couldn't help her. Just because you can't help her by finding that magic cure immediately, don't abandon her. Continue to welcome her. Continue to find new ways. Refer her to people that you meet that you think might be able to help her. You know, that's really, to me, valuable patient care.
I find you incredibly inspiring.
Oh, well, thank you.
Thank you.
I appreciate it.